there are a lot of organs in the body. And when I'm teaching them for the first time, I like to ask my students, hey, does anyone know what this thing does? And most of the time, my students have some kind of sense or intuition as to what that thing does, right? So if I say like the liver or the kidneys or even the pancreas, right? Like people may not know what the pancreas does necessarily, but almost everyone has heard at one point in time that has something to do with diabetes. And so like you're able to kind of piece things together. But without fail, when I ask, what does the spleen do? Like it's crickets. Like this is just one of the most mysterious organs. For whatever reason, it just hasn't made its way into like culture as a whole. And so in today's video, our goal is to learn about the spleen. Now we're going to be approaching this from a macro anatomy standpoint. So basically, like imagine you're holding a spleen, you're looking at it, it's like what could you see? Although we will discuss its function and a little bit of the micro anatomy. Now, to do this, we're going to be using one of Kenhub's 100% free articles. Now, we've gone ahead and left a link down in the description below for you to check out. You can follow along as you go through this. This is an outstanding article, and these things are built like in medical encyclopedias. So there is so much to see, so much to learn, but let's go ahead and dive into this. So I'm going to come down here, and I like to hit this magnifying glass, and that is going to just give us a really great view of the spleen. And so we basically have to understand where the spleen is in order to really make sense of everything here. And we're going to see an image of where it is in the body in just a moment, but I want to see if you can try and orient yourself through these images just based on the names. And that's going to be right here. So you can see that there is a visceral surface, and then we also have what is known as a diaphragmatic surface. And so if we can break these terms down, viscera means guts, whereas diaphragmatic is in reference to the diaphragm muscle. And the diaphragm muscle being that skeletal muscle that divides the thoracic cavity from the abdominal pelvic cavity. It is also going to be essential for breathing. Viscera is, again, meaning guts. If we look at the terms in here, you can start to piece this together. And I think this is a really great exercise for anyone to go through if you're trying to just kind of understand what you're looking at. If you ever see a labeled image like this, try and break down the terms. So for example, if we look here, you can see where it says renal impression. And that's what all of this is going to be right here. This is all going to be the renal impression. You can see that it's kind of like shaded. We have like this crisscrossing little black pattern, almost looks like a net going on here. Well, renal means kidney. And in fact, this is where the left kidney and a bit of what's called the suprarenal gland or your adrenal gland is going to be resting against it. Now, I say left kidney because the spleen is only on your left. This is in the upper left quadrant of your abdomen, or if you decide to divide it more so into the 9 areas, this would be the left hypochondriac region. So basically like right near your ribs, like tucked underneath your ribs on your left side, is where your spleen is. And this thing is massive, by the way. It's about like the size of your hand, and it varies in size based on mass, right? So taller people are going to have a bigger one, right? So if you're Shaquille O'Neal, I don't know how big your spleen is, but it's enormous, and it's a lot bigger than mine. I can tell you that for sure. But so we can see renal impression. You look over here, it says gastric impression. And that's going to tell us that the stomach is going to be touching this portion here. And then if we come down, you can see where it says colic impression. That is in reference to the colon. Now, what I want to do is I want to jump out of this and I want to show you these things. Now, again, I really think it's valuable to look at it from that perspective in order to try and just orient yourself. And as I'm scanning down here, you're going to see that there is a ton to this article. And again, this is 100% free. So go ahead and we're going to go to this image here, and this gives us a better idea of where it is resting inside of the body. And so what you're looking at is the liver with the gallbladder, and then we can also see, and I'm going to just kind of get this text to come up here, we can see part of the stomach here. Now, the stomach comes all the way around, and then it's going to turn into this section here called the duodenum. This is part of the small intestine, but it's been cut. So a good portion of the stomach has been removed, as well as some of the small intestine up here, and then the rest of where the small intestine would transition has also been cut. Then if you look here, we can see a portion of the pancreas, and then some of the pancreas has been cut. Now, this image is focusing primarily on the blood vessels that we're just not going to be worried about. I mean, we can see the splenic artery right here, but our focus is this thing right here. This is the spleen, right? Because you're looking at this, right, as it's situated on the body, right? So you're looking at this from an anterior view, and you're looking in the upper left quadrant of the abdomen. If you look here, you can even see part of the diaphragm. So the diaphragm is going to be like this, which would make this whole surface right there the diaphragmatic surface. And then, so like all along this edge, and then we can also see another surface here. And again, look, here's the stomach, which would make sense for the gastric impression. Now, what we're not also seeing is that the large intestine, right? So the colon, so there's the transverse colon and then the descending colon. Basically, what's going to happen is in this little nook right here, this is where we're going to have what's known as the splenic flexure. So it's basically like the transverse colon is where your colon is crossing from the right to the left side of your body, and then all of a sudden it turns down, right? It starts to go into the descending colon. That's exactly what we're going to have right here. So what we also can't see is then behind the pancreas is where you're going to find that left kidney and that left adrenal gland, which would be resting on top. So basically, you can really get a really intuitive sense as to why that in this surface right here is what we call the visceral surface, and then over here we have that diaphragmatic surface. I think that's a pretty good setup, so I'm going to go ahead and scan back up. Now, I do want to mention that our articles do have premium features like our quiz mode. There's also going to be a video embedded at the top. Again, those are premium features, but they are fantastic features that I encourage everyone to explore. All right, so let's go back to this view here, and I think now you can kind of understand a little bit better of what we're looking at. Now, there's also these other, again, this is anatomy. We like to orient you as to which edge are you looking at. So if we look here and you see superior border, well, that's going to give you a strong sense that this is going to be in the superior direction. Then if we look down, well, you can see it more here on this side. We'll get there in a moment. But look, you can see again that colic impression. We can see the gastric impression. So here would be the gastric impression. Here would be that colic impression. And then we have that renal impression. Now, what's not labeled in this image is everything you're seeing here is what we call the hilum of the spleen. And you're going to find hilum, that's a very common term. You're going to see like a hilum of the kidney, the hilum of the lungs. Like, it's basically just like this spot where all the vessels are going in and out of. And we're going to be discussing very briefly what the spleen is actually up to here in a moment. But what you can see is the hilum is bordered by these ligaments. So this one up here is what's called the gastrosplenic ligament. And then down here, we have that splenorenal ligament. So basically, it's like you can see these connective tissues. These come from something called the peritoneum. The peritoneum is a really, really interesting and fascinating tissue that we can discuss in a different video. But basically, the peritoneum helps divide the body from front to back. So, for example, if you've ever heard a term called retroperitoneal or intraperitoneal, that is basically just saying like there's a literal piece of tissue that's going basically in the center of your body, and there are things behind it, and then there are things in front of it. Well, what's interesting is this is where it's kind of splitting, right? So you can see like the front side of the peritoneum and then the back side of the peritoneum. The spleen is kind of what we would call intraperitoneal. It's like it belongs to it, like the peritoneum turns into it, more or less, but then there's a portion of it that is going to be retroperitoneal, right? So like that's basically what we're looking at here with these little dividers, which are creating the borders of that hilum. Now, then we also now can talk about the blood vessels that are going in and out of it. And so you can see the splenic artery is labeled here in red, and then we have the splenic vein. Now, again, we're going to discuss what it does in just a moment, but let's just go ahead and finish out what we're seeing here in terms of the terminology. So all of this, though, is that visceral surface. So let's look on the diaphragmatic surface, and then you can see what we call a posterior extremity, right? Just telling you the portion of the spleen that's on the posterior side, right? It's angled towards the posterior side, and then there's even an anterior extremity, because what this image isn't really showing you is you are looking at it from a lateral view. So it's like, look at this image and then kind of imagine it's twisted, right? So you're looking at it like this. Imagine it just going like that, and what would happen is this posterior extremity starts to be angled posteriorly, and the anterior extremity down here is now pointing forwards. And then we also can see that there would be an inferior border. So the diaphragmatic surface is very smooth, which makes sense because it's going to be rubbing against the diaphragm and kind of like just being pushed against the border of the body. Now, what I'm going to do is to best explain why there is a splenic artery and a splenic vein. I mean, everything needs blood supply, but we also just got to understand what the spleen is going to do. Now, to do that, I'm going to come down to an image that we're just not going to dive into as much as I would love to. That would just make this video a good half an hour long. So our goal to just look at this is you're looking at a cross-section of the actual spleen, and you are getting to see the nitty-gritty of what is going on inside of it. You can see stuff like we see here called the white pulp. Then you even have the red pulp. So the white pulp is basically, just to give you a real quick understanding, like you can see like this blood vessel here, then you can see all this white around it, but then if you look, you can see like there's this red shade with all these blue sinusoids inside of it. My point here is this: the spleen basically acts, or does two things. Well, three things. Right? So one of them, it's basically a giant lymph node. So the white pulp is where you're going to find a bunch of like white blood cells, lymphoid tissue. This is like basically blood gets filtered through here looking for potential foreign pathogens, foreign invaders. It's a vital piece of your immune system. Another function, though, is where red blood cells are recycled. So in the red pulp, this is where red blood cells, which last for about 120 days, are going to be taken, and then they're going to be broken down into their bare constituents, and then can be recycled in the body. And then the other function, that third function that we could say for the spleen, is it also holds on to a lot of blood. It's considered a blood reservoir. So imagine if you have a really serious bleed and you're losing a lot of blood. Well, luckily, as long as you can get that bleeding to stop, the spleen can actually empty its reservoir and it can restore the normal blood volume inside of your body. Obviously, you can lose too much blood. The spleen can only hold so much. But yeah, that should hopefully make sense. And that might give you a strong intuition then as to why this is considered a removable organ, right? This is kind of like one of those tissues or organs, I should say. Let's go down here and look at it from this view. That can be removed, right? You may have heard of what's called the splenectomy, right? A splenectomy is where you remove the spleen. And that happens due to a variety of reasons. In fact, and this is one of my favorite things about our articles, I'll scan down all the way to the bottom. You can see we like to put these little clinical relations boxes in here, and you can see the different causes of a splenectomy. So you can see maybe splenomegaly, right? So maybe it's too big, maybe it got ruptured, there's an infection. A wandering spleen is really interesting. The spleen can actually start to drift throughout the abdominal cavity. It can go all the way down towards your pubic symphysis, which is wild. That's like the portion just right above the genitals. And then there can even be certain blood disorders. So you can remove the spleen and people can survive. But that doesn't mean it doesn't have a good function. Again, if we look at it from this video, you can this image, you can see the spleen hiding right here. It's important because, yes, while you can live without it, it's not as though it doesn't have purpose and function and doesn't contribute to a wide variety of things inside of your body, again, like we discussed. But the spleen is an absolutely amazing, amazing organ, and hopefully you now understand it. If you did, it would really mean a lot to us if you could hit the like button. I know it sounds like a small thing, and you're like, another YouTuber asking about the like button. But little things like that actually go a really long way and would help us as a channel, as a company, but would also help the people. The people can learn more about their spleen and understand how awesome it is. And while you're down there, if you want to go ahead and leave a comment, let us know if you do want a really robust breakdown of the microanatomy. I know we just barely skimmed the surface, but if you're interested, we love to give the people what they want. But thanks for hanging out with me. I will see you next time.